Welcome, everyone. Welcome to our first town hall meeting for 2021. Thank you for joining us this morning. I'm Andrew Schiff. I'm the CEO here at the food bank. Since the beginning of the pandemic, we've held these virtual town hall meetings to update supporters of the food bank and our colleagues about the impact of COVID-19 on the people served by the food bank, food insecure families in Rhode Island. This morning, we're going to be joined by Rachel Flum from the Economic Progress Institute. EPI is a research and policy organization dedicated to improving the economic well-being of low and modest income Rhode Islanders. EPI recently released their Rhode Island Standard of Need report, which shows the real cost of meeting basic needs for families of different sizes. And in a little bit, Rachel is going to join us to discuss their findings. If at any point during today's meeting, you have a question for me or for Rachel, just click on the Q&A box at the bottom of your screen, type in your question, and we'll be sure to save time for everybody's questions and try to answer all your questions. Today's meeting is also available in Spanish translation, and I'm happy now to introduce food bank staff member Renzo Arteta, our community resource coordinator, who can explain how it's going to work. Welcome, Renzo.
Buenos días, me llamo Renzo y si te gustaría escuchar hoy en español, busca el botón de interpretación en la parte inferior de Zoom, que parece como un mundo, y escoge el idioma Spanish. Gracias por asistir hoy. Thanks, Andrew.
Thank you, Renzo. You know, it's exactly 1 year ago that the first case of COVID-19 was identified in the United States. That's last January. And by March, hospitals in Rhode Island were overwhelmed with cases of COVID-19, and the economy tanked. And we've seen ever since the fallout, which has been hardest for low-income families and low-wage workers. You know, there are many, many examples, but just to pick one, because of the pandemic, more people are working remotely, working from home. And so consumers aren't purchasing clothing for work. So retail stores have suffered and they've gone bankrupt. They've laid off workers. Recently, the communication staff at the food bank interviewed a woman at a food pantry who explained that she works at a dry cleaner. Same story, the dry cleaner seeing and having fewer customers. So they've cut back her hours, and suddenly she finds herself with less income, but all of her bills are still there. She has to pay all of the same expenses. Just imagine, what would you do in her situation? You'd run through your savings, might go into debt, and you might end up where she was, which was turning to a food pantry to feed her family. She is not alone. Since March, we've seen thousands and thousands of new people who never needed food assistance before, turning to member agencies of the food bank for help. The number right now served each month is 68,000 Rhode Islanders. And, you know, they're all facing very similar dilemma. Low income, low wages, which leaves them unable to afford the high cost of living in Rhode Island, the high cost of rent and utilities and childcare. So the food bank has responded by increasing our distribution of food through our statewide network of food pantries and meal sites for the hardest hit cities of Providence, Pawtucket, Central Falls, Woonsocket, and Newport. We've increased food distribution by 40% since March. And back in November, when we released our status report on hunger, we called on Congress to act and pass another COVID relief bill to increase unemployment benefits for folks who are out of work, to increase SNAP benefits. And by the end of December, fortunately, Congress did act, and another COVID-19 relief bill was passed. And now, with the new Biden administration, they're proposing an American Rescue Plan, which will extend and expand a lot of government assistance for struggling families. And, you know, I am very interested in hearing Rachel Flum's perspective on the Biden administration's proposals and also her thoughts about what we can be doing at the state level. Rachel, please join me. Hey, good morning. You got to unmute. There you are.
Good morning. Thank you, Andrew.
How are you?
I'm good, thank you. Thank you for having us here today.
I'm so glad you're here. You know, it strikes me that the problem of income inequality has been with us a long time in Rhode Island. If anything, COVID-19 has just made it much worse.
Absolutely. You know, we have been doing a report that I'm going to talk about today for a number of years, and it is not new that Rhode Islanders are struggling to meet their basic needs. But I think COVID has really showed us pockets of folks that are struggling more or are more on the cusp of falling into debt and using up their savings in a crisis like this.
Well, tell us about the report.
Sure, absolutely. So let me just share my screen really quickly. Let's see, there we go. So we here at the Economic Progress Institute, for those of you who aren't familiar with us, we are a research and advocacy organization that looks to improve economic security for all Rhode Islanders. And we have been around for about 20 years. And what we have done on a pretty regular basis is every other year, we put out this standard of need that looks at what it costs for Rhode Islanders to meet their basic needs and how government work support programs can help when earnings are not enough, which all too often are the case, that earnings are not enough. So it's great to be here with everyone today and see some new names and some board members and longtime supporters of the Institute. And also I just wanted to thank very briefly our staff members who really have written this report and made it happen. So thank you to Alan Krinsky, Linda Katz, and Juan Espinosa. So the first thing that we have aimed to show with this RISN is what examples of a budget for a single adult, a single mom with 2 children, one school-aged and one toddler who is in childcare, and then a 2-parent family with 2 children. And so I thought it would be helpful to start by giving what our calculations look like. So this is an example for a mom with 2 young children. We use, where we can, Rhode Island specific data, but often we're using national sources because Rhode Island is so small. So this is based on the US Department of Agriculture's fairly conservative cost for what a mom with 2 kids would need a month to meet their food needs. So this mom would need $739 just to meet their food needs. Housing costs, we're assuming that she is renting a 2-bedroom apartment for the 3 of them. We know that the housing crisis here in Rhode Island has reached extreme levels, but this is the fair market rent for a 2-bedroom rental. Healthcare costs, we're assuming she is working and she does have healthcare that's affordable through her employer, but still out-of-pocket expenses put her about $597 a month. And then childcare costs. For the toddler, we are assuming that toddler is in school full-time, and she is a school-aged child who just needs after-school and summer care. Just with those expenses, the fair market rent for the fair market cost, the cost for childcare in the survey that's done of all childcare in the state would cost $1,500 a month, which we know is more than the cost of college in many cases. And then because public transportation is largely not available in Rhode Island, we assume that this mother has a car, but has out-of-pocket expenses of about $429 a month for gas and different things that may, oil changes, etc. We also know that with kids and with anyone, there are out-of-pocket miscellaneous expenses, clothing, toiletries, over-the-counter medications. And so we put that at about 10% of overall costs. So this mom with 2 kids needs, just to meet her basic needs, for $4,800 a month. So what does that look like overall? For this mom, it shows that she has expenses of $57,000 a year. Over half of that is just her childcare costs and her housing costs. Why is this important? One of the reasons is that means that after taxes, this mom needs to be earning over $66,000 a year just to meet her basic needs. Again, we do this calculation for a 2-parent family and a single adult as well. For the 2-parent family, their expenses are $64,500 a year, meaning they need to be earning over $73,000 a year. And for the single adult, he or she needs to be grossing $30,000 a year. So as we think about what the minimum wage is here in Rhode Island, the minimum wage right now is $11.50 an hour. That just was increased in October of 2020. This single adult is making $14.70 an hour, so well over the $11.50. For the single parent family, she needs to be earning over $31 an hour to meet this earnings required. And then the 2-parent family needs to be earning $35 an hour. So as we think about the minimum wage, it is way short of what our calculations show families and individuals need to meet just their basic needs. We think it's important to show these examples because often people think that who is struggling in our state and in our country are those that are living in poverty. But the reality is the federal poverty level is based on a 1950s calculation of food that is then adjusted every year. The idea was that food took up 1/3 of a family's budget, and the reality is that childcare costs and housing costs have grown much more significantly so that now a single parent family needs over 2.5 times the federal poverty level just to make ends meet. And the adult, single adult needs to be earning twice federal poverty level. And far too often in Rhode Island, folks are not meeting those income requirements. Especially, we know that disproportionately our Black and Latinx households are not making enough to meet those expenses. This chart shows that for our single adults, 72% of Latinx Rhode Islanders are not meeting that threshold of $30,000 a year. For our single parent families, 91% of Latinx parents are not making the requisite amount of $66,000 to make ends meet. And, so across the board, this is a problem for all Rhode Islanders, but especially for our Black and brown neighbors. So the second thing we try to show with the standard of need is how work support programs can help when earnings are not enough. We know that people can go to the food bank, and thank goodness that those supports are there. But we know that there are other ways that government can support when earnings are not enough. So these are just the list of the kinds of work support and other support programs that are available. And one thing that our RISN tries to do is show examples of how these supports can help when earnings are not enough. So in the report, we talk about Nicole, who's a single mom with 2 young children, and she is earning just under $15 an hour in her job. She would be eligible for health insurance through the Medicaid program if her employer's health insurance is not affordable, and she would be eligible for the Childcare assistance program. She would pay a co-payment amount for her childcare. So this example is just meant to show that with the childcare and healthcare subsidies, she is ending her month with about $263 in income that she can use on other needs or savings. Without those programs, she would be in the hole $1,200 a month. So these programs really are so important in helping people meet their monthly expenses. Some of our programs, however, are not nearly sufficient. If you look at the Rhode Island Works program, which is the cash assistance program for moms with young children, that program, which there are only about 9,000 Rhode Islanders, the vast majority of those are children in the program. That amount that those families receive is only $554 a month, and that amount has not been increased in 30 years. This mom would be eligible for SNAP benefits, which is the food stamp program, but even with both Rhode Island Works and the SNAP benefits, her monthly income is $1,100 a month, which is well below what her expenses would be. The SSI program, which is for seniors and young folks with disabilities, again, the state amount of that has not been raised in almost 20 years. And as you can see, the net monthly income from that program, in addition to the SNAP amount, still puts them well below what they need to meet their basic needs. So those are the things that we've included in the standard of need for years. But this year, with the COVID overlay, we wanted to show some other examples of how our essential workers are faring, and also how the additional supports that went into that were provided by the federal government this year have helped. So if we look at Stacy and Pete, that's our example. Stacy, we're assuming, earns about $14 an hour as a direct care worker. Those are folks who are working with, seniors to help them live in their homes and not have to go into a nursing home. Those are jobs that cannot be automated and that people still needed during the quarantine and lockdown period. Assuming that Stacy is married to to Pete, who works in a grocery store, again, a job which was considered essential, in which those of us who were able to stay home very much relied on having people continuing to do those jobs. So together, this couple is earning $52,000 a year. Assuming they have 2 young children, they are eligible for childcare assistance and for the Right Care Medicaid program for their children. They would not be eligible for the SNAP program. And, you know, if they, and even with tax credits, they are still finding themselves with a difference between their income and their expenses of $11,000 a year. You know, the taxes work, they come out at the end of the year, but to just give an example, you know, that is putting them in the hole almost about $1,000 a month, which, you know, can very quickly add up in terms of a debt that people are looking at. So we clearly have a disconnect between how the jobs that we are calling essential and what we are paying these workers. So the last piece that I just wanted to highlight is how the additional government support that largely came from the federal government has helped workers in this time. The last example we give in the report is of an individual named Paula, who is working as a childcare worker. She, in March, was working full-time and was earning about $1,900 a month. And she was eligible for the SNAP program on top of that. So she was doing slightly better than the federal poverty level at $2,000 a month. When childcare was closed mandatorily because of COVID, she normally would have found herself on regular unemployment, which would only have been $972 a month. Even with the supplement for her 2 children and with SNAP benefits, she would find herself below the federal poverty level. Fortunately, the federal government came through and had a significant bump for UI of $600 a week between April and July. So this shows that our example of Paula, that she was doing significantly better than she was even doing working full-time with that additional support. Again, she's not wealthy by any stretch of the imagination. You know, she's just earning enough to meet her expenses. Then in August, the $600 ended, but there was an additional $300 a week. So this just shows that even that $300 bump made her in a position where she was able to meet her family's expenses. In addition, in August, the SNAP benefit was increased for everyone who had already been in the SNAP program. So you can see that that also was a bump for her and her family. And then hopefully by September, she was back working full time. So her income again was the $1,900 a month. And then with that additional SNAP benefit, she was finding herself better than she had been previously. So again, you know, this is just a way of showing that workers need more than they're earning right now with low wages and the low minimum wage, and that the government can come in and provide those supports to help people meet their basic needs. And I'll just flag that the whole RISN is on our website, and there we also have a short 2-page infographic that folks may find helpful in digesting and sharing these pieces as well.
Thanks so much, Rachel.
Thank you.
You know, I want to follow up on sort of where you were just at the end, thinking about the Biden administration's proposals and their rescue plan. What are some of the elements of that that you think will help?
So certainly, you know, both the Biden administration and the Rhode Island General Assembly is talking about the minimum wage increase to $15 an hour. Certainly you can see from our examples that workers need more than the $11.50 to make ends meet. And so, a basic floor would be $15 an hour. Also, the conversations about continuing higher SNAP benefit amounts, thinking about ongoing unemployment boosts, and even the universal basic income conversations, that people need a floor to meet their expenses, and that we should be providing that for all workers who are doing those jobs that allow the rest of us to live healthy and productive lives. So those are some of them. There are other, housing moratoriums, thinking about how to make sure that people are able to stay in their homes and not lose their homes in this crisis, looking at student loan debts and forgiving that large debt that families are covering that we don't even include in these examples, but that we know are additional burdens that families are carrying, I think are all important suggestions.
Absolutely. It's been frustrating to see that Connecticut and Massachusetts have already passed legislation to increase the minimum wage to $15 an hour, and we're lagging there. But you mentioned that there's a possibility that if the federal legislation doesn't come through, that at the state level we could move on that this year?
So yes, there has been legislation introduced by the Senate that is co-sponsored by the Senate President that would get us on a path to 15 by 2024. So we would still be lagging our neighbors who are both on a path to get to 15 by 2023. And, we think it's too slow, but at least it is moving in that direction. It sounds like there's strong Senate support. We have heard the Governor Raimondo at least talk about it. We're not sure where Lieutenant Governor McKee is yet on this proposal, but we also think there is support in the House as well. So we are hopeful that will move this year.
Excellent. Well, I'd like to introduce Lisa Roth-Blackman, our Chief Philanthropy Officer here at the Food Bank. Lisa's been looking at the questions that audience members are posing. Good morning, Lisa. Are there any questions?
We do have a couple. Good morning, everybody. Rachel, the first one is for you. Somebody's asking, what are the EPI's legislative priorities this year?
Yes, so certainly we are very committed to working on increasing the minimum wage. Our other priorities are focused on looking at that Rhode Island Works benefit that I mentioned that hasn't been increased in 30 years, trying to increase it to at least an amount where people are earning half of the federal poverty level. Currently, the amount they're receiving is 30% of the federal poverty level. So that is our Raising RI campaign. We're focused on the Childcare Assistance Program, making sure that childcare providers are supported so they can come back after the pandemic, and that families are able to access high quality, affordable childcare. Looking at the paid leave program, that Rhode Island, is really a leader in providing paid sick days and paid family leave, which was very important for families during this pandemic, making sure that lower income Rhode Islanders can access those programs. And then the other part of our work is around looking at making sure the state has adequate revenues to support these programs and to support the goods and services that we all enjoy. So we're looking at asking those in the state who are most able to pay higher taxes to do so. We have a tax proposal that would raise the personal income tax on those earning over $475,000 a year.
Great. We have one comment, just because I don't think you'll see this, Rachel, from Carol. This report is a great resource to use when advocating for improvements for people who are struggling. I shared it broadly. Thank you. So I want to make sure you guys hear how useful it is. And then we have another question, which you guys touched on a little bit, but I wonder, Rachel, if you're able to touch on even more broadly, how does the data in Rhode Island compare nationally or with neighboring states? So you talked a little bit about Connecticut and Massachusetts, but any other comments on that?
Sure. So we do not do a side-by-side analysis of sort of the needs piece of this, the expenses piece. We do know that New England overall is an expensive place to live compared to, Mississippi or someplace in the South. So we don't think that our expenses are out of line with our neighboring states. Just the region is an expensive place to be. Compared to the income side of it, however, we know that our poverty rates are among the highest in New England consistently. And so there is work to do in terms of better supporting our residents in compared to our neighbors, if that's helpful.
Great. And then we have a question about, can you explain why childcare and housing costs have risen so much?
Sure. So this was based on the cost of food in the 1950s. We know since the 1950s, demographics have changed. Women have gone into the workforce. They're using childcare much more than they were previously, families were. And the housing costs, that's a whole book on why housing costs have gone up. But again, we are not an outlier. We don't mean to suggest that Rhode Island is an outlier in either of those things. That is just the way that the entire country has gone. Childcare has become something that families need and use, and housing has also just increased much more significantly than it was in the 50s.
I think one of the things that's so painfully ironic in your report is that essential workers who've gotten so much attention in COVID-19, working full-time, can't afford basic expenses, particularly childcare.
Absolutely. And the other point we just want to make about childcare is that childcare providers are often these essential workers who are struggling. So even though the cost of childcare is high, it is not because the childcare providers themselves are making a lot of money. Instead, it is just the nature of the field. We want to have small ratios so that there are, a few number of children that each provider is taking care of. We want to make sure that the environments are safe, that they have educational components, and all of that just costs money. And the business model for childcare providers is just not one that allows for a lot of overhead. So, that's the other ironic thing, is that childcare is such a large expense for families, and then our childcare providers are barely making ends meet. And so the whole structure of the system is really broken. And, we're pleased that the Biden administration plans to invest in that structure and that system. And we hope that that's something that gets a lot more consideration going forward, because the whole, the business model doesn't work either for families or for those providers.
Great. So Rachel, I wonder if you can speak a little bit for anybody on the call listening and wondering what they can do individually to help or to participate or advocate. Can you speak a little bit to individual actions people might take?
Sure, absolutely. So if you go to our website, we have a Get Involved section. It lists the different campaigns that we're working on, and there are opportunities to engage with those campaigns when we have different events. You know, I'm sure you've had speakers who've said this before. The beauty of Rhode Island is that it is small, and all of the representatives and senators, if they hear from 10 folks, they pay real attention, right? And so being able to have folks call and raise these issues as concerns really does make a difference in terms of highlighting issues that are important and that people should focus on. So writing letters, writing emails, picking up the phone and calling, all are really helpful and important. And then, you know, we will, if you sign up for our e-news, there will be more sort of campaign type Zoom calls. You know, that's the world that we're living in right now, but ways to engage with legislators in that way as well, to let them know that these are issues that are important to you.
Great, thank you. Any other comments, Andrew or Rachel? Anything you want to add to the discussion?
You know, I would just following up what Rachel said, we sent the food bank status report on hunger to everyone up at the State House. So you should absolutely get in touch with your state rep, state senator, and ask them what they made of that report. What are the ways in this legislative session are they going to address the needs of people who are struggling right now? And our expectation is that the difficult economy is going to continue for quite a while. So there needs to be an effort at the state level, matching the effort that's coming from the federal government to help people who are in dire need. You can really help us that way by getting in touch with your legislators and just reinforcing what we're telling them too.
Absolutely. And the other piece that I just want to highlight again is, you know, we're in a moment where the racial disparities have really come to light as well, both here and across the nation. And I think both the status of hunger and our report, you know, try to make the case very starkly that it is our Latinx and Black Rhode Islanders who are bearing the brunt of not being able to make ends meet in this moment. And so asking and requiring our legislators to focus on that and try to have some specific targeted interventions is really important in this moment to make sure we don't go back to sort of the old normal where people were struggling, but it wasn't as in the forefront and talked about. We can't go back to the way it was before because it wasn't working before either.
Great, thank you. There was a question I answered, and I want to make sure everybody knows that this is being recorded, so you will be able to review it and to share it. We'll send it out in our e-news in a day or two. So if there are folks who you know couldn't be on here who you want to see and hear this data, that will be available. And I think seeing no other questions, I'm going to wrap it up. I really want to thank David Moreno for doing our translation. This was a first-time experiment for us, and hopefully it's gone smoothly, but muchas gracias. We thank you for being with us today. Rachel, thank you, and Andrew, and we'll be sending out a new town hall opportunities soon, so we hope to see everyone again in the next few weeks. Take care, and thank you.
Thank you, Lisa. Thanks, Rachel.
Thank you.